I'm Dr. Javid Hadian. I'm a cardiologist, subspecialist in clinical cardiac electrophysiology. After finishing my schools in the Netherlands, I went to the Johns Hopkins for my training, first in US and then Indiana University. I was faculty at Ohio State University in early 2000s and then left to private practice. I see patients with heart rhythm disturbances, patients with palpitations, patients with cardiomyopathy and weakness of the heart muscle, and I see patients who are at risk of sudden cardiac death. First-line providers should feel free. Anytime they have any questions regarding the heart rhythm problems, they are welcome to contact me. Any patient with palpitation, any patient who has weakness of the heart muscle, any patient that they find to be at risk of sudden cardiac death, they are welcome to refer to me. If any time they have any suspicion of weakened heart muscle, to order echoes to see what the heart muscle is doing. And if it's any weakness there, needs to see a cardiologist to address that, why it is there. Atrial flutter has a certain circuit that we can cure it 95% and above, almost 99%. But when it changes, it turns into AFib, the success rate drops. For paroxysmal AFib, 2/3, for persistent and chronic AFib to 50%, and in some literature, 30%. Thus, if you see any atrial flutter, it's a very good idea to refer them to electrophysiologists for long-term outcome of these patients. Patients with cardiomyopathy, patients who have weakness of the heart muscle, they can benefit from defibrillator implant. ICDs save lives in those patients. Those can be very functional life years that can be added. I do implant regular pacemakers, cardiac defibrillators, ICDs, and biventricular pacemaker ICDs, which are also known as CRTD, cardiac resynchronization defibrillator, and CRPs, which are cardiac resynchronization pacemakers. ICDs give the shock if the patient gets ventricular tachycardia. Biventricular pacemakers do not give the shock, but they still synchronize the heart rhythm by synchronization of the electrical activity of the myocardium. I do EPS study to map the arrhythmia and ablate them. I do all aspects of cardiac ablations, from supraventricular tachycardia to ventricular arrhythmia, and basically any patient with palpitation. There are also patients who have some symptoms which are very difficult to correlate to arrhythmia. At times, there are patients whose EPS studies are negative. In those patients, we have the capacity to implant small devices called loop recorders. It is a simple procedure which takes about 5 minutes. After numbing the left anterior chest, to implant it under the skin. And those recorders have a battery which lasts about 2 years. If any heartbeat too fast or too slow, it will record, and you can go back, review at that time whether the patient had any arrhythmia to correlate to the patient's symptoms. And they give us a lot of information.